Hey everybody, it's Barbara Cape, president of SEIU-West. Happy Thursday. This week has felt like 2 weeks crammed into one. It's been busy and there has been so much information coming our way. But yesterday was Pink Shirt Day, and it's a day that we recognize the importance of, having an anti-bullying culture. And I have spent this past week talking with members and listening to some pretty outrageous and horrific stories about abuse. Abuse that our members are seeing and feeling from the public in the course of their daily work. And that is unacceptable. Nobody knows better than frontline essential workers how exhausting this year has been. We're at the 1-year anniversary of a pandemic shutdown, and every single essential frontline worker has been carrying more than their share of the load. And when I think about, an anti-bullying culture, that's not just us. That's not just with other coworkers or with brothers and sisters in the union. That has to be applied to the public, and the public needs to be held accountable for abusive and outrageous behavior. So if you are in that situation in your facility or in your service, and you come across a member of the public or a patient, client, resident, or a family member who is abusive, you need to report that. We need to take action, and people need to know that that's unacceptable, and we will not stand for it. You are professional, you're extremely skilled at the work that you do, and you do not come to work to be abused by anybody. And that doesn't just mean being abused by people outside of our sectors. That also means, we need to take a moment. I know you're exhausted. I know that this has been a year that has driven anxiety for all of us in a way that nobody could have ever expected. But we need to take a moment because we sometimes lash out at the people who are closest to us, whether it's our own families or our coworkers that we see every day. So I encourage you to just take a moment, think about what you're saying before you say it. Make sure that we're supporting each other, because nobody knows what this year has been like other than the people we work with closest. And the other thing that this year has really brought, or this week rather, has really brought forward is, the sickness and the passing of people in the healthcare system, frontline brothers and sisters who have died from COVID. And, I think all of us were aware that this was going to be a distinct possibility because of our role at the front line of this pandemic. But, hearing about the brother from North Battleford who passed away from COVID, it rocked me back on my heels. It truly shook me to my core. And so that is for those who have passed away, but those who have been sick with COVID. And there are so many frontline essential workers who have contracted COVID. You need to take care of yourself. You need to make sure you're seeing your doctor. If you contracted COVID and you're not sure if you contracted it at work, contact the Member Resource Center, file a WCB claim, because long-term effects from COVID are unknown at this point. The science hasn't gotten us there. So we really need to make sure that we're thinking about not just next week or next month, but next year, and taking care of our health for our families and for ourselves. And then finally, we have the Hey Mo, Where's Our Dough campaign. And that is a campaign where we are calling on the government of Saskatchewan and the premier of the province to release the temporary wage subsidies to all healthcare workers across the province. We're asking people to take a selfie in your full PPE gear and talk about, put up a sign that says what you do and the fact that you are an essential worker. And that's for healthcare workers, that's for folks who work at Canadian Blood Services, the community-based organization sector, anybody who's deemed an essential worker. We want to make sure that the temporary wage subsidy that's come from the federal government is shared broadly for all essential workers. But we've pivoted a wee bit and shifted that campaign to say, hey, Mo, where's our vaccines? Because there are a growing number of folks who are frontline essential workers. And the best practices, the recommended advice from the National Advisory Committee on Immunizations says that we should be vaccinating healthcare workers first. And so what we need to be doing is asking, you know, I'm a unit assist on 5,300. Where's my vaccine? I'm a security officer at Humboldt Hospital. Where's my vaccine? You guys are essential. You are incredibly key to bending the curve on this pandemic. So whether you work in a group home, whether you work in a daycare, we need to see those vaccines going out to essential workers. And the science does show us that when you vaccinate that essential group, that vaccination, that immunization spreads throughout the community. And so we're relying on the best advice of scientists in order to make this argument and to launch this campaign. So go to our website, go to our Facebook page if you want to participate. And we want to make sure that you get the dough that was promised to us from the federal government, and that you get the vaccines that should really be in the arms of frontline essential workers first. It's the best practice for the whole province. Take care out there, everybody. Be well.